1. What is the primary cause of systolic heart failure? A. Myocardial infarction. B. Chronic hypertension. C. Valve regurgitation. D. Pulmonary embolism. Answer: A. Myocardial infarction. Rationale: myocardial infarction is a major cause of systolic heart failure due to the loss of functional myocardial tissue, leading to reduced cardiac output. Chronic hypertension, B, can lead to diastolic dysfunction. Valve regurgitation, C, can contribute to heart failure, but it's less commonly the primary cause of systolic heart failure. Pulmonary embolism, D, affects the lungs, not directly causing systolic heart failure. 2. Which clinical symptom is most commonly associated with heart failure? A. Headache.
B. Dyspnea.
C. Chest pain. D. Nausea. Answer: B. Dyspnea. Rationale: dyspnea, or shortness of breath, is the hallmark symptom of heart failure due to fluid accumulation in the lungs. Headache, A, is not a primary symptom. Chest pain, C, may occur with underlying coronary artery disease, but is not typical of heart failure. Nausea, D, may occur in severe cases, but is not as common as dyspnea. 3. What does an elevated B-type natriuretic peptide, BNP, level indicate? A. Kidney failure. B. Pulmonary embolism. C. Heart failure. D. Liver disease. Answer: C. Heart failure. Rationale: BNP is released by the heart in response to increased wall stress, typically seen in heart failure. Kidney failure, A, pulmonary embolism, B, and liver disease, D, can affect BNP levels, but heart failure is the primary condition associated with elevated BNP levels. 4. What is a common first-line treatment for systolic heart failure? A. Calcium channel blockers. B. ACE inhibitors. C. Statins. D. Aspirin. Answer: B. ACE inhibitors. Rationale: ACE inhibitors reduce afterload and improve symptoms in systolic heart failure. Calcium channel blockers, A, are not typically used in systolic heart failure management. Statins, C, are used for cholesterol management but do not directly treat heart failure. Aspirin, D, is used for blood thinning, not for heart failure. 5. Which of the following is a non-pharmacological intervention for managing heart failure? A. Low-sodium diet. B. Complete bed rest. C. High-protein diet. D. Alcohol consumption. Answer: A. Low-sodium diet. Rationale: a low-sodium diet helps reduce fluid retention, which is beneficial in managing heart failure. Complete bed rest, B, is not recommended for heart failure patients. A high-protein diet, C, is not specific to heart failure management. Alcohol consumption, D, can worsen heart failure symptoms. 6. Which imaging study is most commonly used to diagnose heart failure? A. Chest X-ray. B. Echocardiography. C. MRI of the brain. D. CT scan of the chest. Answer: B. Echocardiography. Rationale: echocardiography is the most commonly used diagnostic tool for assessing heart function, including ejection fraction. Chest X-ray, A, can show pulmonary congestion but is not definitive for heart failure. MRI of the brain, C, and CT scan of the chest, D, are not standard for diagnosing heart failure. 7. Which of the following is a risk factor for developing heart failure? A. Smoking. B. Hyperthyroidism. C. Diabetes mellitus. D. Hypotension. Answer: C. Diabetes mellitus. Rationale: diabetes increases the risk of developing heart failure, often through mechanisms like coronary artery disease and hypertension. Smoking, A, and hyperthyroidism, B, are also risk factors, but not as directly linked to heart failure. Hypotension, D, can be a result of heart failure, but is not a primary risk factor. 8. What is the primary role of beta blockers in the treatment of heart failure? A. Increase heart rate. B. Decrease fluid retention. C. Improve cardiac contractility. D. Reduce heart rate and blood pressure. Answer: D. Reduce heart rate and blood pressure. Rationale: Beta blockers decrease the heart rate and blood pressure, improving heart failure symptoms and reducing mortality. They do not increase heart rate, A, or improve contractility, C, directly. While they may reduce fluid retention, B, their main effect is on heart rate and blood pressure. 9. What is a major complication of untreated heart failure? A. Pulmonary embolism. B. Stroke. C. Pulmonary edema. D. Hepatitis. Answer: C. Pulmonary edema. Rationale: pulmonary edema occurs when the left side of the heart fails, leading to fluid accumulation in the lungs. Pulmonary embolism, A, stroke, B, and hepatitis, D, are not direct complications of heart failure, though they may occur in certain patients. 10. Which of the following medications is used to reduce fluid overload in heart failure patients? A. ACE inhibitors. B. Diuretics. C. Beta blockers. D. Anticoagulants. Answer: B. Diuretics. Rationale: diuretics are used to reduce fluid overload by promoting urination, which helps decrease edema in heart failure patients. ACE inhibitors, A, help control blood pressure and reduce symptoms, but do not directly reduce fluid overload. Beta blockers, C, reduce heart rate and blood pressure, but do not primarily target fluid. Anticoagulants, D, are not used for fluid overload. 11. Which heart failure type is characterized by preserved ejection fraction? A. Systolic heart failure. B. Diastolic heart failure. C. Right-sided heart failure. D. Acute heart failure. Answer: B. Diastolic heart failure. Rationale: diastolic heart failure is characterized by preserved ejection fraction, where the heart has normal contraction but poor relaxation, leading to inadequate filling. Systolic heart failure, A, has reduced ejection fraction. Right-sided heart failure, C, typically affects the right ventricle and does not refer to ejection fraction. Acute heart failure, D, can involve either systolic or diastolic dysfunction. 12. What is the primary purpose of an implantable cardioverter defibrillator, ICD, in heart failure patients? A, to control blood pressure. B, to prevent blood clots. C, to treat life-threatening arrhythmias. D, to reduce fluid retention. Answer: C, to treat life-threatening arrhythmias. Rationale: the primary purpose of an ICD is to detect and treat life-threatening arrhythmias, such as ventricular fibrillation, that can occur in heart failure patients. It does not control blood pressure, A, prevent blood clots, B, or reduce fluid retention, D. 13. Which of the following is a common side effect of ACE inhibitors? A. Hyperkalemia. B. Hypotension. C. Nausea. D. All of the above. Answer: D. All of the above. Rationale: ACE inhibitors can cause hyperkalemia, A, hypotension, B, and nausea, C, as common side effects, especially when starting therapy or adjusting doses. 14. What lifestyle change is most important for preventing the progression of heart failure? A. Increase sodium intake. B. Engage in regular exercise. C. Limit alcohol consumption. D. Increase protein intake. Answer: B. Engage in regular exercise. Rationale: regular exercise improves cardiovascular function and helps manage heart failure symptoms. Increasing sodium intake, A, would worsen fluid retention. Limiting alcohol consumption, C, is also important, but secondary to exercise. Increasing protein intake, D, is not a primary prevention strategy for heart failure progression. 15. Which of the following is a risk factor for diastolic heart failure? A. Hypertension. B. Myocardial infarction. C. Pulmonary embolism. D. Hypothyroidism. Answer: A. Hypertension. Rationale: hypertension is the most common risk factor for diastolic heart failure because it leads to left ventricular hypertrophy and impaired relaxation. Myocardial infarction, B, contributes to systolic heart failure. Pulmonary embolism, C, and hypothyroidism, D, are not major risk factors for diastolic heart failure. 16. Which of the following medications is most appropriate for treating acute pulmonary edema in heart failure patients? A. Furosemide. B. Metoprolol. C. Warfarin. D. Digoxin. Answer: A. Furosemide. Rationale: furosemide is a loop diuretic that quickly reduces fluid overload, making it the most appropriate medication for acute pulmonary edema. Metoprolol B is a beta blocker used for long-term management, not acute pulmonary edema. Warfarin C is used for anticoagulation, and digoxin D is used for heart rate control but not for acute fluid overload. 17. What is the main feature of right-sided heart failure? A. Pulmonary congestion. B. Edema and fluid retention. C. Low ejection fraction. D. Increased blood pressure. Answer: B. Edema and fluid retention. Rationale: right-sided heart failure causes systemic edema and fluid retention, especially in the legs, abdomen, and liver. Pulmonary congestion A is more typical of left-sided heart failure. Low ejection fraction C can occur in both types of heart failure, but is not specific to right-sided failure. Increased blood pressure D may result, but is not the main feature. 18. What is the role of sodium restriction in heart failure management? A. To increase fluid retention. B. To decrease the workload of the heart. C. To increase blood pressure. D. To prevent arrhythmias. Answer: B. To decrease the workload of the heart. Rationale: sodium restriction reduces fluid retention, which decreases the workload of the heart. It does not increase fluid retention A or blood pressure C. While it may help prevent arrhythmias D, indirectly, its primary benefit is in reducing heart workload. 19. What is a typical sign of left-sided heart failure? A. Jugular vein distension. B. Peripheral edema.
C. Orthopnea.
D. Abdominal pain. Answer: C. Orthopnea. Rationale: orthopnea, difficulty breathing while lying flat, is a hallmark symptom of left-sided heart failure caused by pulmonary congestion. Jugular vein distension A and peripheral edema B are more associated with right-sided heart failure. Abdominal pain D can occur with fluid buildup in the liver, but is not a primary sign. 20. Which of the following therapies can help prevent the progression of heart failure? A. Angiotensin receptor blockers ARBs. B. Calcium channel blockers. C. Anticoagulants. D. Antidepressants. Answer: A. Angiotensin receptor blockers ARBs. Rationale: ARBs, like ACE inhibitors, help reduce heart failure progression by blocking the effects of angiotensin II, which constricts blood vessels and increases fluid retention. Calcium channel blockers B and anticoagulants C do not directly prevent heart failure progression. Antidepressants D are not used for heart failure management. 21. Which of the following is the most common cause of chronic heart failure? A. Diabetes mellitus. B. Coronary artery disease. C. Hypertension. D. Valve disease. Answer: B. Coronary artery disease. Rationale: coronary artery disease is the leading cause of chronic heart failure due to reduced blood supply to the heart muscle, leading to damage. Hypertension C and diabetes A are also important risk factors, but coronary artery disease is the most common. Valve disease D contributes to heart failure but is less common. 22. Which of the following is the primary function of the heart's right ventricle? A. Pumping blood to the lungs.
B. Pumping blood to the body.
C. Receiving oxygenated blood from the lungs. D. Controlling heart rate. Answer: A. Pumping blood to the lungs. Rationale: the right ventricle pumps deoxygenated blood to the lungs for oxygenation. The left ventricle B pumps oxygenated blood to the body. The right atrium C receives blood from the body, not the lungs. The heart rate is controlled by the sinoatrial node, not a specific ventricle D. 23. What is the primary goal of heart failure treatment? A. To cure the disease. B. To slow down the progression and manage symptoms. C. To increase heart rate. D. To eliminate all medications. Answer. B. To slow down the progression and manage symptoms. Rationale. The main goal of heart failure treatment is to manage symptoms and slow disease progression, as heart failure is a chronic condition that can't be fully cured. Increasing heart rate, C, or eliminating medications, D, is not a goal. 24. Which of the following is not a symptom of left-sided heart failure? A. Orthopnea. B. Paroxysmal nocturnal dyspnea. C. Hepatomegaly. D. Pulmonary congestion. Answer. C. Hepatomegaly. Rationale. Hepatomegaly is more commonly associated with right-sided heart failure due to congestion of blood in the liver. Orthopnea, A. Paroxysmal nocturnal dyspnea, B. And pulmonary congestion, D. are all common symptoms of left-sided heart failure. 25. Which of the following is a common side effect of diuretics used in heart failure treatment? A. Hypokalemia. B. Hypertension. C. Hyperglycemia. D. Weight gain. Answer. A. Hypokalemia. Rationale. Diuretics promote the excretion of sodium and water, which can lead to a loss of potassium, causing hypokalemia. Hypertension, B. Hyperglycemia, C. And weight gain, D. are not typical side effects of diuretics. 26. Which of the following can exacerbate heart failure symptoms? A. Increased physical activity. B. Excessive salt intake. C. Regular sleep schedule. D. Regular use of diuretics. Answer. B. Excessive salt intake. Rationale. Excessive salt intake leads to fluid retention, which can exacerbate heart failure symptoms. Increased physical activity, A, can be beneficial if properly managed. A regular sleep schedule, C, and diuretics, D, are helpful in managing heart failure. 27. What is the primary function of an ACE inhibitor in heart failure management? A. Increase heart rate. B. Reduce fluid retention. C. Decrease blood pressure and afterload. D. Promote blood clotting. Answer. C. Decrease blood pressure and afterload. Rationale. ACE inhibitors help reduce blood pressure and decrease afterload, resistance the heart must pump against, which improves heart failure symptoms. They do not increase heart rate, A, or promote blood clotting, D. They do reduce fluid retention, but their primary effect is on blood pressure. 28. What does a heart failure patient's ejection fraction typically indicate? A. The amount of blood pumped by the heart per beat. B. The amount of blood the heart receives from the lungs. C. The overall size of the heart. D. The speed at which the heart beats. Answer. A. The amount of blood pumped by the heart per beat. Rationale. Ejection fraction refers to the percentage of blood pumped out of the heart with each contraction. A reduced ejection fraction indicates poor pumping ability. It does not indicate the amount of blood received from the lungs, B, heart size, C, or heart rate, D. 29. What type of heart failure is associated with an ejection fraction of less than 40%? A. Diastolic heart failure. B. Systolic heart failure. C. Acute heart failure. D. Right-sided heart failure. Answer. B. Systolic heart failure. Rationale. Systolic heart failure is characterized by a reduced ejection fraction, less than 40%, indicating that the heart cannot pump blood effectively. Diastolic heart failure, A, typically has a normal ejection fraction. Acute heart failure, C, and right-sided heart failure, D, are not specifically defined by ejection fraction. 30. What is the role of spironolactone in heart failure treatment? A. It increases blood pressure. B. It helps reduce fluid retention. C. It increases potassium levels. D. It promotes heart muscle growth. Answer. B. It helps reduce fluid retention. Rationale. Spironolactone is a potassium-sparing diuretic that helps reduce fluid retention in heart failure patients. It does not increase blood pressure, A, or heart muscle growth, D. And while it can raise potassium levels, C, its primary role is fluid management. 31. Which of the following is an early sign of heart failure? A. Dyspnea on exertion. B. Severe leg swelling. C. Jaundice.
D. Seizures.
Answer: A. Dyspnea on exertion. Rationale: dyspnea on exertion is an early sign of heart failure as the heart struggles to supply enough oxygenated blood during physical activity. Severe leg swelling, B, and jaundice, C, typically appear later in the disease, and seizures, D, are not associated with heart failure. 32. What is the primary goal of using vasodilators in heart failure treatment? A. To increase heart rate. B. To reduce blood pressure and reduce the heart's workload. C. To increase fluid retention. D. To stimulate the production of red blood cells. Answer: B. To reduce blood pressure and reduce the heart's workload. Rationale: vasodilators help relax and widen blood vessels, which reduces blood pressure and the workload on the heart, improving heart failure symptoms. They do not increase heart rate, A, fluid retention, C, or red blood cell production, D. 33. Which of the following best describes preload in heart failure? A. The pressure the heart has to pump against. B. The volume of blood returning to the heart. C. The speed of the heart's contraction. D. The amount of oxygen the heart receives. Answer: B. The volume of blood returning to the heart. Rationale: preload refers to the volume of blood returning to the heart, which stretches the heart muscle before contraction. Afterload, A, refers to the pressure the heart has to pump against. The speed of contraction, C, and oxygen supply, D, are not related to preload. 34. Which of the following can cause acute decompensated heart failure? A. Infections. B. Smoking cessation. C. Regular exercise. D. Sodium restriction. Answer: A. Infections. Rationale: infections can increase the body's demand for oxygen, leading to acute decompensation in heart failure patients. Smoking cessation, B, regular exercise, C, and sodium restriction, D, are generally beneficial for heart failure management. 35. What is the effect of alcohol on heart failure? A. It strengthens the heart muscle. B. It can worsen heart failure by increasing fluid retention and blood pressure. C. It has no effect on heart failure. D. It increases ejection fraction. Answer: B. It can worsen heart failure by increasing fluid retention and blood pressure. Rationale: alcohol can worsen heart failure by contributing to fluid retention and increasing blood pressure. It does not strengthen the heart muscle, A, increase ejection fraction, D, or have no effect, C. 36. Which of the following is a common complication of untreated heart failure? A. Pneumonia. B. Renal failure. C. Liver cirrhosis. D. Stroke. Answer: B. Renal failure. Rationale: untreated heart failure can lead to renal failure due to reduced kidney perfusion. Pneumonia, A, and stroke, D, are possible complications but are less directly related to heart failure, and liver cirrhosis, C, is not a common complication. 37. What role does the brain natriuretic peptide, BNP, test play in heart failure diagnosis? A. It helps identify the underlying cause of heart failure. B. It measures the level of fluid retention in the body. C. It helps assess the severity of heart failure. D. It identifies heart failure as a chronic condition. Answer: C. It helps assess the severity of heart failure. Rationale: BNP levels increase in response to heart failure, and the test is used to assess the severity of the condition. It does not directly identify the underlying cause, A, fluid retention, B, or diagnose heart failure as chronic, D. 38. Which of the following is a common cause of right-sided heart failure? A. Coronary artery disease. B. Hypertension. C. Pulmonary hypertension. D. Diabetes mellitus. Answer: C. Pulmonary hypertension. Rationale: pulmonary hypertension, which increases pressure in the lungs, is a common cause of right-sided heart failure. While coronary artery disease, A, hypertension, B, and diabetes, D, can contribute to left-sided heart failure, they are less directly associated with right-sided heart failure. 39. What is the role of beta blockers in heart failure treatment? A. Increase heart rate. B. Reduce heart rate and blood pressure, reducing the heart's workload. C. Promote fluid retention. D. Stimulate the heart's electrical system. Answer: B. Reduce heart rate and blood pressure, reducing the heart's workload. Rationale: beta blockers reduce heart rate and blood pressure, easing the heart's workload. They do not increase heart rate, A. Promote fluid retention, C. Or stimulate the electrical system, D. 40. What is the effect of a pacemaker in heart failure patients? A. It speeds up heart contraction. B. It helps regulate the heart's rhythm in patients with conduction problems. C. It increases the heart's pumping ability. D. It reduces heart rate to lower blood pressure. Answer: B. It helps regulate the heart's rhythm in patients with conduction problems. Rationale: a pacemaker helps regulate the heart's rhythm in patients with conduction abnormalities, which may be present in heart failure. It does not speed up contraction, A. Increase pumping ability, C. Or reduce heart rate, D. 41. What is the primary function of the left ventricle? A. Pump blood to the lungs.
B. Pump blood to the body.
C. Receive deoxygenated blood from the body. D. Control heart rhythm. Answer: B. Pump blood to the body. Rationale: the left ventricle pumps oxygenated blood to the entire body, except the lungs. The right ventricle pumps blood to the lungs, A, and the right atrium receives deoxygenated blood, C. The heart rhythm is controlled by the sinoatrial node, D. 42. What is the primary cause of coronary artery disease? A. High blood pressure. B. Atherosclerosis. C. Diabetes. D. Valve disorders. Answer: B. Atherosclerosis. Rationale: atherosclerosis, buildup of plaque in the arteries, is the primary cause of coronary artery disease. High blood pressure, A, and diabetes, C, are risk factors, but they do not directly cause the disease. Valve disorders, D, are unrelated to coronary artery disease. 43. Which of the following is not a common symptom of a heart attack? A. Chest pain or discomfort. B. Shortness of breath. C. Severe headache. D. Nausea or vomiting. Answer: C. Severe headache. Rationale: severe headache is not a common symptom of a heart attack. Chest pain or discomfort, A. Shortness of breath, B. And nausea or vomiting, D. are common symptoms. 44. What is the role of nitrates in the treatment of heart failure? A. To increase heart rate. B. To decrease preload and afterload by dilating blood vessels. C. To improve heart rhythm. D. To reduce fluid retention. Answer: B. To decrease preload and afterload by dilating blood vessels. Rationale: nitrates work by dilating blood vessels, reducing both preload and afterload, which eases the workload on the heart. They do not increase heart rate, A. Improve rhythm, C. Or reduce fluid retention, D. 45. What is the first-line treatment for acute coronary syndrome? A. Diuretics. B. Beta blockers. C. Antiplatelet drugs. D. Angiotensin-converting enzyme inhibitors. Answer: C. Antiplatelet drugs. Rationale: antiplatelet drugs are used as the first-line treatment for acute coronary syndrome to prevent further clot formation. Diuretics, A. Beta blockers, B. And ACE inhibitors, D. are important but are typically used in the management of chronic heart conditions. 46. What is the most common diagnostic test used to evaluate heart failure? A. Echocardiogram. B. Chest X-ray. C. Electrocardiogram, ECG. D. Blood test for BNP. Answer: A. Echocardiogram. Rationale: an echocardiogram is the most commonly used test to evaluate heart failure, as it can assess the heart structure, function, and ejection fraction. Chest X-rays, B, and ECGs, C, are supportive tests, while BNP tests, D, are useful for diagnosing but not evaluating the heart's function in detail. 47. What is the main function of the sinoatrial SA node in the heart? A. To control heart rate by initiating electrical impulses. B. To pump blood to the lungs. C. To regulate blood pressure. D. To control the contraction of the ventricles. Answer: A. To control heart rate by initiating electrical impulses. Rationale. The SA node generates electrical impulses that set the heart's pace and rhythm. It does not pump blood, B, regulate blood pressure, C, or control ventricular contraction, D. 48. What is the effect of aldosterone in heart failure patients? A. It increases blood vessel dilation. B. It decreases potassium levels. C. It promotes fluid retention, worsening heart failure. D. It lowers blood pressure. Answer. C. It promotes fluid retention, worsening heart failure. Rationale. Aldosterone promotes sodium and water retention, which increases blood volume and exacerbates fluid buildup in heart failure. It does not dilate blood vessels, A, decrease potassium, B, or lower blood pressure, D. 49. What is the primary goal of using anticoagulants in heart failure treatment? A, to prevent blood clots. B, to reduce fluid retention. C, to strengthen the heart muscle. D, to reduce heart rate. Answer. A, to prevent blood clots. Rationale. Anticoagulants prevent blood clots from forming, which is important in heart failure patients who are at risk for clotting due to reduced blood flow. They do not reduce fluid retention, B, strengthen the heart, C, or affect heart rate, D. 50. What is the main reason for fluid retention in heart failure patients? A, excessive salt intake. B, impaired kidney function due to reduced blood flow. C, increased physical activity. D, low blood pressure. Answer. B, impaired kidney function due to reduced blood flow. Rationale. In heart failure, the heart's reduced pumping ability decreases blood flow to the kidneys, triggering fluid retention. Excessive salt, A, can worsen this, but impaired kidney function, B, is the primary cause. Increased physical activity, C, and low blood pressure, D, are not directly responsible for fluid retention.